Dora and Ron, you can follow me this way. Hi, I'm Dr. Amory.
Ron.
Hi.
My wife Dora.
Nice to meet you. I'm Dr. Amy.
Ron.
Nice to meet you. Dr. Amy.
What brings you guys in today?
Well, my brother just had a baby and it was diagnosed with DMD.
And we know that DMD runs in both our families.
So we were encouraged to look further into the likelihood of our child being diagnosed.
See, I am pregnant with a baby boy, and all the new information is concerning us.
Come to the right place. In order for your child to have DMD, Dora must be a carrier of this trait.
If I'm a carrier, then wouldn't I have symptoms of DMD, like muscle aches and trouble walking or running?
Well, this disease is more common in males because women can be carriers, meaning they have the mutated gene, but are not affected by the disease. If that mutated gene gets passed down to the male baby, then he automatically will be affected because he only has one X chromosome.
If Dora is a carrier, could she possibly be affected later on in life because it's present in her gene?
No, because her other X chromosome compensates for the affected X chromosome. And if one is affected by the disease, the symptoms occur between ages 3 and 15, and most don't live past that, so you would know by now, Dora.
Well, what are these symptoms?
Well, DMD is a muscular disorder that the symptoms include progressive muscle weakness, delayed development of motor skills in childhood, enlarged and weakened heart, and unfortunately don't have a cure. But we shouldn't jump to conclusions. We should test you before we make any assumptions.
I read online that we could get a blood test to see if we carry it.
Well, since you're a male, you're unable to be a carrier, Ron, so we will be taking blood from Dora to see if she's a carrier of the DMD gene.
How is this blood test going to show if Dora is a carrier or not?
Dora's blood sample is a trace of her DNA, which goes through the process of gel electrophoresis, where the DNA sample is placed into a medium and an electric current passes through and separates the DNA with restriction enzymes, which cut DNA into fragments. We will then compare Dora's DNA to a normal unaffected DNA sample, and if the size and the amount of the cut/fragments are the same, we will know Dora is not a carrier.
And here's a diagram of it.
If I'm a carrier, how would you test our baby, and is it safe?
Well, the process is called amniocentesis, and we normally test between the 15th and 18th week of pregnancy, and since you're in your 16th week, this is perfect. The process of amniocentesis includes the doctor locating the position of the fetus and placenta with a simple ultrasound, and the doctor then inserts a thin hollow needle through your abdomen and uterus and into the amniotic sac away from the baby. And a small amount of fluid will be removed from the needle and sent to the lab to be analyzed, and you won't feel any of this during the process.
Are there any risks to Dora or the baby?
Yes, with any procedure, there are risks, but they are very rare.
So what exactly are the risks?
Less than 1% chance of a miscarriage and or injury to the baby or the mother, such as an infection. And Dora, you might feel menstrual cramping or discomfort for a few hours after the procedure, but nothing major.
And how accurate is this procedure?
The accuracy of amniocentesis is about 99.4%, but let's check Dora and see if she is a carrier first. Are you agreeing to the blood test?
Yes, of course.
Alright, follow me this way and we'll take you to the lab. Welcome back.
Thank you.
Let me go grab your test results.
I'm so nervous. I haven't slept this whole week.
This has definitely been a stressful couple days.
We have wonderful news.
Your test results show that Dora is not a carrier, which in turn means there's no possibility of your son being affected by DMD.
This is the greatest news.
Thank you so much, doctors.
Oh, you're welcome.
Thank
You're
you.
welcome.
Now Dora and I can go watch the Steelers kick ass.
Yeah,
Go
go
Steelers!
Steelers!